Welcome to Integrated Health of Indiana, and this is going to be the explanation of the GI map. And so this is mine. This is my most recent one I did in April. And so we're going to go through this and we're going to look at the overall, and we're going to kind of go through how I read this. So the first thing I do actually is I scroll all the way down to the last page or last couple of pages, and I start to look at intestinal health markers. This is where I want everything to be in the green. And as you can see, my pancreatic elastase is low. When I see that, we immediately start to think about, okay, we can start to form biofilms, so there can be infections in the gut that need to be addressed with enzymes. And so I see that there's no steatocrit, so my ability to digest fat is good, and I am absorbing all of that. But the elastase, which are brush border enzymes and other things, that's not looking so good, and I've known that for a while. That's why I actually do supplement with those. Next is looking at beta-glucuronidase. This is a marker of estrogen dominance, and I am still a little high. Now, the way that we start to take care of this is I do lifestyle modifications. I also start to dig into what are some deficiencies that can cause this. There is no occult blood. When we start to see occult blood in men, if we see occult blood, that's an immediate referral. In women, we ask if they're on their period. There are some things to do there, but when we see this, we really start to worry about, okay, is there something else going on? Secretory IgA, that's the first defense of the gut. So my secretory IgA is there. So my gut is nice and lined, and it doesn't allow things that I eat that are irritants to get into the bloodstream. Next thing is antiglidin IgA. Antiglidin IgA and zonulin kind of go hand in hand. When I did this test, I was just kind of eating as I want to, and I had started to consume a little more bread, so my zonulin went up, and I am not surprised to see antiglidin IgA. That means I am actively breaking my gut down at the same time. So even though my secretory IgA is good, I know it's being attacked by antiglidin IgA. Eosinophilic activation protein, we start to think about allergies and stuff. There's nothing really there. Calprotectin is up, and that's an inflammatory marker. Once again, goes hand in hand with the zonulin. I know what causes it, and I'm actively going through. So I do know that I have some pancreatic elastase issues, and I start to worry about biofilm forming bacteria, and then how do I also take care of those? So we go all the way back up here with that in mind. I start to take a little more critical look. Well, do I have any of the bacterial pathogens? Do I need to go through a kill phase? Nope, not on that set. Do I have any of the parasites? Nope, not on this set. And viral pathogens? No. Next, we start to look at a bug that I have fought with. I have more than halved the appearance of this bug in myself, and I will continue to work on that because I still notice, like, if I do stray from my diet. The other day we had pizza, and I did actually drink a couple of beers, and I did have some upset stomach that night, and I know why. Gluten from the pizza and the beer feed H. pylori. It causes uric acid to be formed, and Helicobacter loves uric acid. Now, we start to look at the keystone and commensal bacteria. And I look at this two ways. One is, are we good with them? So I am not low in anything. If anything, I am high. And as I look at that, I know this has to be addressed because overgrowth causes another set of symptoms. And so when I see I am high in 1, 2, 3, 4 of these, I know I have an issue. And then when I look at the families overall, I see both of these are high, and that indicates something that I need to address. I know what it is, and I am addressing it. So these are things that we look at. Firmicutes to Bacteroides ratio, though, looks good. And that's why I'm not having immune response and autoimmune type issues and stuff like that. I just have too high, so I got to take care of it. Next, we look at opportunistic microbes. And here is where we see in me the pancreatic elastase is allowing things to go a little haywire. I am borderline on a lot of these. Now that Enterococcus faecalis, I'm super high. And so I have to go through a kill phase or culling phase, I should say, because these are opportunistic overgrowth. So we got to knock these way down. And then a lot of these, the Pseudomonas, the Streptococcus, these are all biofilm forming bacteria. And so I have got to knock those down. And recently, until I started actually my protocols, I was getting the itchy arm again. So next thing is looking at commensal overgrowth. So commensals are bacteria that you want to have, but we want to have them in a balance. My best way to kind of explain this to somebody is it's like your kids. You want your kids to hang with the good kids, because if they're hanging with the bad kids, they start to tend to do bad things. And so when we see commensals, which are your kids, you should have these. When we see them getting high, and we see all these other players up here that are high, then abnormal biochemistry can happen. And so we want to knock this down, and we want to, what happens when your child does something wrong? You discipline them. So we have to knock this down. We have to get this in balance. We are seeing where my inflammatory and autoimmune related bacteria are high. So once again, the cull phase, when I go through this, or as I'm going through this, is going to knock these down. I'll be retaking this. I started my cull phase, and we're a month out. I'll probably take this again next month and see where I'm at. Enterobacter, that's high once again, and it's part of the commensal inflammatory. So this is part of your immune system. So you want these to be in range. But I'm high on that one, so then that starts to make me more pro-inflammatory, and things like my thyroid will go wild. And I start to look at my eyebrows, and is that outer third of my eyebrows, that's a physical manifestation of autoimmune thyroid, which I have had in the past. Lovely Candida is there. Once again, we're looking at, we have to cull this down, and then we have to retake it. Parasites, this Dientamoeba fragilis, got to slow down so I can say that, is high or getting high in me. He kind of floats through. So as all of those other things are high and allowing opportunistic bacteria or protozoa to do things, we see him start to come out of biofilms and do bad stuff. So I've got to knock him and that Endonymix nana, we got to knock those down. And once again, getting rid of the protozoa, we look at this and we say, hey, we got to do a cull phase, no problem. No worms, and now we're back to the intestinal health markers. So I do this as well as anything that I ask my patients to do, both myself and my wife have done. And so when we do this and we talk about this with people, we speak from experience with it. And you have to get these things in check before you can really, truly feel good. Right now, I feel great. I feel really good. But if I stray from the straight and narrow, then I also know that I have strayed from the straight and narrow because I hurt and it causes things in my stomach. But for the most part, I can do whatever I want to do and I'm not having issues. So if you have any questions about the GI map, go ahead and hit me up at Dr. Miller, Dr. Miller at integratedhealthofindiana.com. We're happy to help you out.